USMLE style question on cystic fibrosis. Question: a 6-year-old boy presents to the clinic with chronic cough, wheezing, and recurrent respiratory infections. He has a history of failure to thrive despite normal appetite and has had frequent greasy stools. Physical examination reveals digital clubbing and bilateral wheezing. Laboratory studies show a sweat chloride concentration of 80 mmHg, normal 40 milliex per L. His family history is significant for a sibling who died at the age of 2 from respiratory failure. Which of the following is the most likely underlying genetic defect in this patient? A. Mutation in the Cftr gene. B. Mutation in the NF1 gene. C. Mutation in the BRCA1 gene. D. Defect in the surfactant protein B. E. Defect in the AAT gene. Answer and explanation. Correct answer A. Mutation in the Cftr gene. This child has cystic fibrosis, a genetic disorder characterized by defective chloride ion transport across epithelial cells due to a mutation in the Cftr gene, cystic fibrosis transmembrane conductance regulator. This leads to thick, sticky mucus in the lungs, pancreas, and other organs, causing chronic respiratory infections, digestive problems, and failure to thrive. Pathophysiology: Cftr mutations impair chloride transport in epithelial cells, leading to increased mucus viscosity and obstruction of airways, lung disease, pancreatic insufficiency, digestive problems, and sweat electrolyte imbalance. Common Cftr mutations include delf-F508, most common, which leads to a misfolded protein and impaired chloride transport. Key clinical features of cystic fibrosis: chronic cough, wheezing, recurrent respiratory infections due to thick mucus, pancreatic insufficiency, greasy stools, failure to thrive, digital clubbing due to chronic hypoxia, salty sweat due to elevated sweat chloride, meconium ileus in newborns, intestinal obstruction, infertility in males due to congenital bilateral absence of the vas deferens. Why not the other answers? B. Mutation in the NF1 gene. Incorrect. Neurofibromatosis type 1 F1 is characterized by cafe au lait spots, neurofibromas, and optic gliomas, not respiratory or digestive symptoms. Mutation in the BRCA1 gene. Incorrect. BRCA1 mutations are associated with an increased risk of breast and ovarian cancer, not cystic fibrosis. D. Defect in the surfactant protein B. Incorrect. Surfactant protein B defects cause neonatal respiratory distress syndrome, not chronic respiratory infections in children. E. Defect in the AAT gene. Incorrect. Alpha-1 antitrypsin deficiency, AATD, causes emphysema and liver disease, not chronic respiratory infections due to thick mucus. Key USMLE takeaways for cystic fibrosis. Cause: Cftr gene mutation, cystic fibrosis transmembrane conductance regulator. Symptoms: chronic respiratory infections, failure to thrive, greasy stools, digital clubbing. Diagnostic test: sweat chloride test, 60 millimet correlator is diagnostic. Inheritance: autosomal recessive. Management: pulmonary hygiene, pancreatic enzyme replacement, inhaled antibiotics, and CFTR modulator therapies. Would you like more details on CF treatment options or other genetic disorders?